A broken bone is also known as a fracture. There's a common misconception that a broken bone is worse than a fracture. In reality, they are the same. There are many different types of fractures or breaks. A bone can be broken and the fragments can be out of alignment. We call this a displaced fracture. Conversely, if they're in good alignment, it's called a non-displaced fracture. If a bone is broken and you can barely see it on X-ray, it is a hairline fracture. Finally, if a bone is broken and one of the fragments has punctured the skin, this is a medical emergency. We call this an open or compound fracture. Since open fractures can easily become infected, immediate surgical management is required. Broken bones are usually splinted initially to prevent bone movement and further damage to the soft tissue that surrounds them. Even though all of this sounds very scary, most fractures can be managed in a cast without going to the OR. Even simple fractures of the toes need to be treated. And yes, we do put cast on toes, not the plaster or fiberglass most people think of. Instead, we use a mesh tape which holds the toe in place. If you or someone you know has sustained an injury in the foot or ankle, we will make every attempt to see him as soon as possible.